So as we'll already know, the parasympathetic nervous system, the sympathetic nervous system physiological actions or functions, they're usually antagonistic. So in other words, they're working in balance with each other. Do we have primarily sympathetic going on? Do we have primarily parasympathetic going on? And so just thinking about that, most organs receiving stimulation from both divisions. But there are a few structures that only receive stimulation from the sympathetic division. That includes the majority of your blood vessels, your sweat glands, and your adrenal medulla. Remember, the adrenal medulla stimulates or releases adrenaline, and so it's only the sympathetic nervous system that causes the release of adrenaline. So what I'd like you to do now is just have a little look at these various structures. Press pause, as usual, and just think about what's going to happen with the parasympathetic nervous system. What's going to happen to the pupil, for example, or saliva secretions, sweat secretions, heart, respiration, etc., etc. And by the same token, what's going to happen if you are stimulating the sympathetic nervous system? What's going to happen to each of those structures or secretions, as the case may be? So press pause and have a little think about it, and then we'll go through it. Okay, so the pupil. So remembering, parasympathetic nervous system is all about rest and digest, so it constricts the pupil. Less light is coming in, and therefore there's less information to process, if you like. Whereas in the sympathetic nervous system, the pupil dilates. So more information is coming into the brain or through the eyes via the optic nerves to the brain, which can process that information and make appropriate responses in a fight or flight response. Saliva, parasympathetic nervous system. Rest and digest, so you have a nice watery saliva secretion. Sympathetic nervous system, think about it, fight or flight, you're very nervous, you're giving a presentation, you're doing whatever it might be, you're all nervous. What happens to saliva production? Becomes thick and viscous. So a much thicker viscous saliva is released. Sweat, parasympathetic nervous system, what happens? No effect. Remember, some structures are only receive stimulation from the sympathetic division. For example, sweat glands. So therefore, the parasympathetic nervous system does not innervate the sweat glands, therefore it has no effect. Whereas the sympathetic nervous system, of course, stimulates copious sweating. Heart. Parasympathetic decreases your heart rate, makes it nice and low and relaxed during that rest and digest phase. Whereas the sympathetic nervous system increases both heart rate and stroke volume. So that's contractility of the heart, the amount of blood that is being pumped out with each heartbeat. Respiration constricts your bronchi, whereas sympathetic nervous system dilates your bronchi so that they open up, allowing more air to come in during that fight or flight response. GI tract. Rest and digest, of course, it increases the parasympathetic nervous system, increases motility, so contractions in the GI tract, and increases secretions so that you can digest and digest all the products that you've been eating. And the sympathetic nervous system does the opposite, decreases motility and decreases secretions. So next we go on to the bladder. Parasympathetic nervous system causes contraction of the smooth muscle of the bladder. In other words, it's trying to stimulate you to urinate. You can inhibit that, of course, because you have skeletal muscle just beyond that so that you can inhibit urine secretion, even though your autonomic nervous system is trying to make you go for a wee. Sympathetic nervous system relaxes it so it inhibits urination. Reproduction. This is actually where the parasympathetic nervous system and the sympathetic nervous system work together. So the parasympathetic nervous system, that causes erection due to vasodilation. So it does innervate the blood vessels in the reproductive system. Nowhere else, okay? Pretty much nowhere else. But it does cause it there, so it causes vasodilation. And if you're thinking about in females, it causes clitoral vasodilation and vaginal lubrication. If we're looking at the sympathetic nervous system, it causes ejaculation. And in the female, it causes the vagina to contract. And of course, if you're thinking about what the sympathetic nervous system also does, if you're thinking about anxiety, that can impair sexual performance because the sympathetic nervous system is in charge, and so an erection may not be possible. And the adrenal medulla. So again, this is another place that the parasympathetic nervous system does not innervate, so no effect. And of course, In the sympathetic nervous system, you get the release of adrenaline. And adrenaline causes vasodilation of the bronchi, smooth muscles, so the blood vessels. It causes the release of glucose from the liver and a manner of other things as well. So you get the release of adrenaline. So when we're thinking about this a little bit more, and we covered this in the first session, when we're thinking about transmission at the autonomic ganglia, both the sympathetic and parasympathetic nervous system, if you remember, it is the same neurotransmitter that is released, namely acetylcholine. So you've got your preganglionic neuron, releases acetylcholine at the autonomic ganglia, binds to your nicotinic acetylcholine receptors, and then our postganglionic neuron goes on to release either acetylcholine or noradrenaline if we're part of the sympathetic nervous system. The effect at the autonomic ganglia is always stimulatory. And so in other words, what this acetylcholine is doing, it's opening up ion channels, depolarizing the postsynaptic neuron so action potentials can fly down the axon and cause their effect on the effector. So what's actually happening in the parasympathetic nervous system post-ganglionic nerve endings? So just thinking whereabouts that is, that's at this end, post-ganglionic, preganglion, postganglion nerve ending. So we're thinking there, we're thinking about interactions at the effector. So at the heart, acetylcholine is released and decreases the rate of beating. At the smooth muscles on the GI tract, acetylcholine increases motility. So in other words, it can either increase or decrease activity of the parasympathetic nervous system effector. So if we're looking at what's happening, here is your CNS, here's your parasympathetic division with the long preganglionic neuron, releases acetylcholine, binds to the nicotinic acetylcholine receptor. Then you get more action potentials, the release of acetylcholine again, binds to the muscarinic acetylcholine receptor. And of course, we're in the parasympathetic nervous system, so it's affecting your smooth muscle, your cardiac muscle, your glands, and your GI neurons as well. So thinking about that, now what is actually happening here? So here is our tissue, okay, autonomic ganglia and our heart, smooth muscle glands, etc. I want to know what's the type of receptor for acetylcholine. So you only have to look at this little diagram. If you look at the type of receptor for acetylcholine in the autonomic ganglion, is it muscarinic or nicotinic? And same thing at the glands, nicotinic or muscarinic. It's all nice and obvious for you. And what is stimulating it? So we'll go through this. You can press pause to do it, or you can just carry on because it's quite an easy question. So the type of receptor is at the autonomic ganglia, which is here. It is the nicotinic acetylcholine receptor or cholinergic receptor. And it's stimulated by acetylcholine and, because of its name, nicotine. Okay, so it's stimulated by those two. And then if we're looking at the glands themselves, or the smooth or heart muscle, we're now at the muscarinic cholinergic receptor, and it's being stimulated by muscarine, which is a type of mushroom poison or toxin, and acetylcholine. So the parasympathetic nervous system is quite simple like that. And depending on the tissue end here, we may stimulate or inhibit, as we've already said. So it decreases the rate of beating at the heart, but increases motility at the GI tract. So what's actually happening in the PNS? So our nicotinic receptors, remember they're autonomic at the autonomic ganglia, and our muscarinic receptors, they're our target tissue. This is where our cholinergic drugs are derived from natural compounds. So acetylcholine is the neurotransmitter, but our drugs, our cholinergic drugs, they're derived from natural compounds. So here's our nicotinic receptor, and remember, nicotine stimulates, as does acetylcholine. Okay, so again, remember we're at our autonomic ganglia. And you have this poison, curare. This inhibits at the nicotinic receptor. So, but while curare doesn't have much of an effect as it happens at the autonomic ganglia, but it does have quite a large effect at the neuromuscular junction. So bearing in mind, it affects nicotinic receptors, and it's affecting mainly the skeletal muscle, so the neuromuscular junction. What are the effects of it going to be on that neuromuscular junction? So as you may expect, it's inhibiting this process, and we're thinking about skeletal muscle. So actually what it does is mainly used as a muscle relaxant. Okay, in particular skeletal muscle, of course, but if you give it in high enough doses, it prevents breathing. So it inhibits diaphragm, the main muscle of breathing, the diaphragm. And of course, this was used to be used in the Amazonian arrow poison tree. Okay, so they used to get it onto an arrow, fire at the animals they were chasing, and it would basically stop them breathing. It would kill the animals. It was also used early on as an anesthetic, as it was thought to cause unconsciousness as well as muscle relaxation. So early clinicians used to give curare to patients. They'd see them completely relaxed because they weren't able to move, so they thought they were unconscious, whereas in fact they were still conscious and they could feel the pain, but they couldn't move to tell anyone. So it was later found to be used with other anesthetics to combat that. If we now look at the muscarinic receptors, that's in our target tissue, remember, muscarine targets that, and atropine, you might have heard of atropine, that is an inhibitor from deadly nightshades. What's the effect of atropine on heart rate? Thinking we're at the parasympathetic nervous system again, muscarine, okay, that stimulates via the parasympathetic nervous system. So I want you to think, what will atropine do? Well, if muscarine stimulates the muscarinic receptor at the heart and causes the heart rate to decrease, atropine, when it inhibits it, is going to increase the heart. It also improves atrioventricular conduction because it's blocking the parasympathetic influences on the heart. Remember, the parasympathetic nervous system usually slows heart rate. So in that respect, when you're thinking what it may be used in some situations, it could potentially be used in some cardiovascular disorders, but mainly in the management of patients with bradycardia, so slow heart rate. So we're now moving on to the sympathetic nervous system and the pre- and postganglionic nerve endings. So remember what happens. They've got a short preganglionic neuron, releases acetylcholine, binds to the nicotinic receptor on the postganglionic neuron and stimulates it. And then the postganglionic neuron usually releases noradrenaline. Not always. There are a couple of exceptions, but usually it's noradrenaline. And of course, noradrenaline can increase or decrease the activity of the effector, just like the parasympathetic can. So at the heart, it increases the rate of beating. At the GI tract, it relaxes and inhibits movements and secretions. And at blood vessels, it generally causes vasoconstriction, except at the heart, skeletal muscle and liver, where it causes vasodilation. So if we're looking at what's actually happening here at the sympathetic division, here's our central nervous system in this orange where I'm pointing, orangey pink. Here's our preganglionic neuron releasing acetylcholine, binds to the nicotinic cholinergic receptor. We then pass down the long postganglionic neuron where we release, on the whole, noradrenaline. And noradrenaline binds to adrenergic receptors from adrenaline or noradrenaline. So it binds to adrenergic receptors where it will have its effect. There is one exception, of course, remembering the adrenal medulla. That also is stimulated by acetylcholine, but instead of having a postganglionic neuron, the hormone adrenaline and to a lesser extent noradrenaline are released directly into the bloodstream, where they go on to have their effect on smooth muscle, cardiac muscle, and GI neurons, etc. Remember, so it's primarily noradrenaline as a neurotransmitter, but occasionally, in a couple of places, it does actually release acetylcholine. The postganglionic neuron releases acetylcholine, so sweat glands, for example. So if we're looking at these, the postganglionic sympathetic fibers, they usually release noradrenaline, as I've talked about a couple of times. But occasionally, they release acetylcholine at the end of the postganglionic neuron. And it binds, as you can see, to the muscarinic cholinergic receptor. And so these ones, they innervate the sweat glands. So this is why you get sweating. It's because of release of acetylcholine binding to the muscarinic receptor. And innervate blood vessels in skeletal muscle. and heart to cause vasodilation to those tissues. So there aren't very many places where it happens, but it does happen in a couple of places. So this is just a nice little summary of what is actually happening in terms of the somatic nervous system, which remember is your skeletal muscle, and the autonomic nervous system, which is automatic, we can't control it. So just thinking about the somatic nervous system at the start, so we're in our CNS, that's down this little bit, and you have your motor neuron leaving the CNS. Remember, there's only one of them there that's leaving the CNS, so you don't have two neurons. And so that releases acetylcholine onto the skeletal muscle, causing contraction. So a similar principle is releasing the same neurotransmitter, but it's affecting skeletal muscle, which you have conscious control of. These ones are slightly faster, so they do travel much faster than the autonomic nervous system, and you can tell that by looking these little blobs. That's the amount of myelin. So you can see these are much more myelinated, so they're faster. You can also see there is no junctions, there's no synapse, because it's a single neuron. So in other words, these synapses take time. You've got to release a neurotransmitter, it's got to bind to the receptor, and then it's got to have it start off that action potential again. So the autonomic nervous system is slower than the somatic nervous system. If we then look at the sympathetic division, again you release acetylcholine at the autonomic ganglia, and then primarily adrenaline. Occasionally, and the difference is with the adrenal medulla, acetylcholine causes the release of adrenaline and noradrenaline into the blood. And the parasympathetic is acetylcholine at the autonomic ganglia and acetylcholine at the target effector area. So again, that's a nice summary diagram, just kind of highlighting what neurotransmitters are being released in each system, somatic versus sympathetic versus parasympathetic. And it does just show you the amount of myelination as well, which indicates the speed that the impulses are actually being transferred from one place to another.